why people should care about their stem cells.
We have adult stem cells in our body. So as we grow up and we develop, we hit like puberty, those stem cells kind of like plateau and they slowly start declining as far as the functionality or really their ability to regenerate to make other tissue.
What is the involvement with stem cells in the brain?
So the thing about the actual stem cell, we hear the word stem cell, we think it's like a living cell that's going to be injected into our body and that's going to somehow mutate into some tissue that we have a deficiency in. The way the science looks at it is two courses. There's one that have that kind of theory, like it's going to change into the existing tissue, like if it's like an axon or neuron or dendrite or something like that. Or there's another possibility is signals, and that's where we're looking at. We're looking at the signaling.
Where do you see stem cells playing a role in longevity?
Activity is not only a physical, but it's a mental tool to help you along. You've got to grow that disc. There's nothing out there that's going to grow that disc unless you have that component that signals your existing tissue to wake up to grow that tissue.
Welcome to the Brain Fitness Podcast. I'm your host, Dr. Patrick Porter. Please join us on our mission to better a billion brains. Enjoy the episode and remember to share it with your family and friends.
Hello, Brain Tap Nation. This is Dr. Patrick Porter. Welcome back to another episode of the Brain Fitness Podcast. Today I have a very special guest, Dr. Tommy Rhee. And what we're talking about, Dr. Rhee, is that you have created a technology that we want to share with the world that is, usually you have to get it injected, but you have a way to do it topically at home. But before we get into all of that and share with them how they can stimulate their own stem cell production, tell us a little about your journey.
Dr. Porter, how you doing? Thank you again for inviting me on this podcast. Okay, journey. So like anything else, we all get born and then we start developing. And then the thing is that my dad was a surgeon, so he was a medical doctor, so there's families of doctors. And then I see what they're doing and I'm kind of brought up in that world, like I'm going to be a doctor, I'm going to be a provider. So as I grow up and I start playing sports, I'm real active. I know I want to specialize in something about sports. So as you get older and you start seeing what doctors and medical aspect, how they treat and take care of, you start thinking like, well, I don't think I really want to get that invasive or do the pharmacological or pharmaceutical stuff. So from that point, I started thinking about, I want to do something that's more of like a prehab or innate intelligence or your own ability to heal yourself. So that's why I thought about being a chiropractor. So I found the best chiropractor in sports, Dr. Santos out in LA, and I followed what he did. So as a mentor, he taught me how to, be that special doctor, and that led me to working at UCLA. Then when those kids graduate, they go in the pro world. So it traveled me a lot of like arenas from tennis to pro to basketball and all this stuff. So then I get to Tampa and I'm with WWE. Then I get involved with the Tampa Bay Buccaneers as a doctor there. And then get involved with athletes that go into the Olympics and world championships and all that. So during that time, I see how they do rehab or recovery from injuries or any type of sporting event. And one of the key ingredients they did was regenerative medicine. So during the time of 2002, I saw regenerative medicine evolve from what they call prototherapy, then the PRP, then stem cell, and then now where RheeGen is at, my product, is the topical regenerative medicine. And what's fantastic about that is that we get to use it. We don't have to have a medical doctor or a facility and the high cost to do regenerative medicine now.
Yeah. So when you think about what you developed and these things, of course, we're working with the brain a lot, of course, brain tap. So when we think about the brain, what is the involvement with stem cells in the brain?
Great question. So the thing about the actual stem cell, we hear the word stem cell, we think it's like a living cell that's going to be injected into our body and that's going to somehow mutate into some tissue that we have a deficiency in. Well, the way the science looks at it is two courses. There's one that have that kind of theory, like it's going to change into the existing tissue, like if it's like an axon or neuron or dendrite or something like that. Or there's another possibility is signals, and that's where we're looking at. We're looking at the signaling. So when we look at stem cells, the mesenchymal stem cells, we're looking at how does it signal, and it secretes this thing called EVs, extracellular vesicles, which is the biomolecules. There's a lot of signals in there from neurotrophic factors to growth factors to microRNAs. There's signals in there. So what it does is it sends out these signals to existing tissue to turn on to regenerate. So when you look at things like brain, if you look at any type of like the structure of the brain is so complex. It's beyond like what you can imagine, and we're still always developing and understanding what's going on. But the one factor is that as we age, there are things that we go through a cycle, right? We build and we break down, we build and break down. So there's a 1-to-1 ratio, even a little better if we can build more than break down, right? So the problem is that I feel that the signaler has gone down in the sense of our existing tissue, the signal to regenerate. So we need to introduce a new signaler, a very vibrant, younger tissue from our RheeGen, from the Wharton's jelly, from the umbilical cord, to signal existing tissue to turn on, wake up, and regenerate to recover those tissues.
That's awesome. So when you were going through your science and going through your research, what did you find? How did you find out about putting it on topical? Because I know I've been using the product here in the morning and at night, and it's going to be 1 month's dose is equivalent to getting an injection, right? To
Correct.
getting it
Yes.
with an IV. So tell us a little bit about that journey.
Okay, like you said, so that 30-day process for RheeGen equates to the same ingredients as the injectable that comes from an umbilical cord called mesenchymal stem cells. So the way I looked at it was that we went through classes as far as the procedure, how to do the injectables and how to approximate. So when it first came out, they would say penetrate through the tissue. Well, when you penetrate through the tissue, that syringe or needle has created more trauma. So now you have, like, let's say if it's musculoskeletal, like a tendon. So you have like maybe a grade 1. Well, when you penetrate through that grade 1, you may create a grade 2 because you now have a new incision point. So now what you think about is that old school mentality has now changed into you approximate, because there's a thing called signaling. It signals or hones into the damaged tissue to migrate down to that area where it needs to be regenerated. So now they teach you is that when you do the injection, you approximate. So when you look at the distance between the needle and the tissue approximate, you're looking at a distance that's almost equates to the distance from the tissue to the skin. I'm thinking like, well, there's got to be something out there that has that transdermal agent that can pull through it, that can carry that molecules through the skin and into the deep tissue. So, of course, we all heard of DMSO. And then after doing some extensive research, we found that that's a perfect vehicle to pull those biomolecules that's from the stem cell on the topical RheeGen to pull to the skin into that damaged tissue deep in the area. So from there, we looked at that we see the science behind that. So the best thing about that is that when you look at how RheeGen is applied versus injectable, the risk factor gets tremendously reduced by 90% because you don't have to have an invasive needle that goes through your skin to get, infected. And more importantly, the downtime from the injection alone has you, especially these athletes, you can't do anything for the next 2 to 4 weeks. And that's why RheeGen is like the perfect application for those active people.
Okay. So if someone has a knee problem or ankle or shoulder or elbow, how do you recommend, or neck, how do you recommend they use it?
All right. So there's in the RheeGen kit, there's an alpha and omega. So there's a pre and a post or morning and evening. So the best way to do it is that you take the RheeGen Alpha, the red bottle, and you just do 2 pumps in your hand, lather it into that damaged tissue. So if it's your knee, if it's like, let's say we talk about the meniscus. So you do 1 pump in the front side and right below the patella. You look at the patella, the kneecap, and you apply it there. Then the second pump, you apply it in the back because you want to do the anterior posterior approach into it. And with that, it'll migrate to that area where the meniscus sits. So if it's something like your neck, well, that's just 2 pumps in your dorsum area or your back area, and then just rub it in there until it like saturates in there. And then it's a 30-day process. So you don't want to skip one. You want to constantly go for 30 days straight, alpha and omega twice a day for that 30-day period.
Okay. What have you seen is happening with these athletes or just for everyday users? I mean, I'm using it just to help with some little pain I have in my shoulder and neck. I'm doing my neck right now, but these are things. So what can I anticipate?
So there's signals in there that's the start of the process. You'll feel that alpha has that thermogenic effect for warmth, and then that lasts for 24 hours. So let's say you do an activity, you'll feel the warmth, and then you shut the morning workout down, and then you go like an afternoon and you start sweating again. Well, it'll turn back on. The activity turns on the RheeGen. So that right there is a biofeedback that you're going to recognize that helps you understand that the tissue is activating. So that's why you need omega. The omega neutralizes the thermogenic effect so you can cool yourself down. Now, when you look at a tissue, when you think about like a damaged tissue, you're looking at especially as an athlete, they don't have the ability to recover quickly because as you age, you slow down. But the thing with athletes, especially professional world, they want to recover faster. The faster you are, the faster you can get back on the field, and then that equates to, their salary or their contract. So that's why RheeGen was generated was because I had an NFL quarterback that was doing stem cell therapy off season. So he's allowed to have that downtime after the injection. Well, his Achilles tendon was getting very bad. So he was going into the camp beginning of the season. So he was concerned about that. We talked about it. He helped me formulate this thing. And then throughout the season, he would tell me to turn it down, turn it up, activate this, do this. And we would talk about it. And then he helped me kind of like fine tune RheeGen to where it lasted the whole season because that was the last, how football players, it's about the contract. So he was in last year, so he can't report that he's injured because that would be like a negotiating thing with him or his other. So he was pain free in the football side, but more importantly, the Achilles tendon recovered during play. So that was that component. Then you look at using that and go, well, if a professional athlete that pounds his body that hard, that would be great for just the average person. So then now we go into anybody that has that kind of like that chronic situation with like tennis elbow, neck pain, low back pain. And it's what it's doing is that it's just turning on your existing tissue to generate. If your disc is arthritically reduced, you've got to grow that disc. There's nothing out there that's going to grow that disc unless you have that component that signals your existing tissue to wake up to grow that tissue.
Right. Tell us a little bit about stem cells and why, as we age, we don't heal as fast. We don't recover as well. People like Tom Brady who, were able to play in the Super Bowl at 44 because he had a lot of recovery time. Tell us a little bit about, why that's important and why people should care about their stem cells.
Yeah. So we have adult stem cells in our body. So as we grow up and we develop, we hit like puberty, those stem cells kind of like plateau and they slowly start declining as far as the functionality or really their ability to regenerate to make other tissue. So the interesting thing about our tissue is that as we get older, we all know that, right? When we're younger, we can actually work out, no big deal, and there's a fast recovery time. But when we're like my age, it's very difficult for us to recover. So with that, just understanding about the existing adult stem cells, those stem cells, you have to go, if we want to go further back into it, let's go into like the chromosome and DNA. So when you look at the existing stem cells, like maybe like a chondrocyte, something that helps you build these tissues. So there's chromosomes in there, there's DNA, right? So we're allowed so many of what they call replications from RNA, DNA, and then you go to things called mitosis and you cell divide, and then you have these daughter cells, and then that's regeneration, right? So when you replicate, you got this thing called a Hayflick limit. You only have so many of these replications occur. So when you look at the end of the chromosomes, the very end is called a telomeres. Telomeres are just like in a shoelace at the end of plastic tips. It's a protective type of like code that says, all right, at the end of the Hayflick, you don't want to replicate anymore because you don't want miscode of these codons. So we don't want to have like odd tissues growing like cancer stuff. So it stops actual replication. So now we're looking at a tissue called a zombie cell or senescent cell. So it just stays dormant, sits there waiting for something to happen. So with these EVs, regenerative medicine and stem cells and RheeGen, not only does it have the signals to do the existing tissue, but also has the ability to increase those telomeres back to its normal length to get that mitosis going. So that is called telomerase. That's an enzyme in Wharton's jelly and mesenchymal stem cell. So it's like a two-part situation where you want to look at regenerative medicine. The first part, you've got to take that senescent cell or the zombie cell, you have to wake it up. You have to get the telomeres to grow to its normal length. So now it's sitting there waiting to go mitosis or cell divide. Then you have the signaler saying, all right, here comes like interleukin 10 or like transforming growth factor. You need that to go down there and say, all right, turn it on. Now it signals and now it goes, okay, I have the ability to turn on because my telomeres is normal length. I can go into replication. Here you go. Now I can replicate. So that's a two-part here. So that's pretty much the signaling concept of regenerative medicine.
Where do you see stem cells playing a role in longevity? Because we call it health span now instead of longevity. It doesn't matter if you live long. If you're, most people, unfortunately, the last 20 years of their life have spent in hospitals and medicines and just basically surviving. They're not thriving. So how would RheeGen help them to thrive?
Okay, so I think the biggest factor when it comes to like that health span or longevity or that just really that active lifespan is staying active. You've got to stay active. Activity is not only a physical, but it's a mental tool to help you along. So if you want to think about the physical aspect of an exercise, a simple walking or some type of movement, think about the simple, like the structure around the brain, the CSF. You've got to get that to move, right? Some of us, we're very sedentary and we're not moving, right? So that CSF, which is a basic component of that getting rid of the toxins, the excess tissue, let's look at like amyloid, right? Amyloid plaque, right? Well, there's a big research about that, is that you've got to get that fleshed out, right? You've got to, because it's accumulated and it's plaquing up, right? So you've got to flesh it out. So exercise is a component. So when you look at regen and you think about those kind of activities that hit the 60s and 70s, and you're like, I can't walk, I can't exercise, I can't get my heart rate because I have tendonitis or something else. Well, you've got to get that tissue to regenerate to do the activity. So that's one fold. And the other fold is, of course, there's so many signals in there that they're understanding that what all the factors from the growth factors and anything to do with the brain signaling to increase the function of the brain. There's so many things going on with this Wharton's jelly and the EVs involved with that they're discovering more and more about the signalers and what it can do to our brain, our body, and the overall health of our whole systemic system.
Yeah. When people come to see you in Tampa there, or some of your doctors that are using RheeGen, how do they evaluate and pick out that patient that needs this?
So in my world, I'm sports, so I'm musculoskeletal. So when I see something that looks like arthritic, or they want to heal fast, or something that just having a chronic situation or repetitive injury, they're a candidate for regenerative medicine.
So when you think about taking this out to the world, when you're explaining this to a patient, and you're saying, hey, I want you to take this home, use this. You probably use it in the clinic as well, but when they take it home, how do you explain to them what they do and things of that nature?
Okay, so when we talk about home care and their home use, we want them to take it home and use that in the morning and evening. The alpha, so there's two parts, right? There's the alpha and omega. The alpha is used in the morning, and then the omega is used at nighttime, 30 days straight. We don't want them to slow the activity down. We want to have them continue because activity is almost like a habit and maybe a therapy session for themselves. So we don't want to disturb them. We want to say, all right, continue on, but we're going to apply regen at home. And then if it's something that's very acute, then you have to go see your therapist or doctor to really hone on to that little issue. But when it's a chronic situation, that's how you use it.
Right. Have you seen people using this after surgeries and things of that nature to help accelerate the healing process?
Yeah. So, yeah, that goes hand in hand right now where you see modern recovery right now. So a lot of orthopedics are using stem cell therapy after the actual surgery to heal the tissue faster. But because of that procedure, added procedure, it's a cost factor. So it's like, why take that $10,000, $7,000 cost where you can just take regen, which is like fractions of the cost and it's safer. And then, of course, you can apply that after the surgery.
Okay. So what have I forgot to ask you about RheeGen that you think the Brain Tap Nation needs to know about?
Well, here's a great thing about Brain Tap and Regen. It's a great biofeedback. If you really want to see how Regen is doing, use Regen and the Brain Tap together. You'll see a difference of outcome. You may see a better outcome or maybe a unique outcome, but I feel that, this partnership is very unique in the sense that you get to really see almost like a biofeedback mechanism in the sense that hey, I click faster. I sense things better. It's like it really enhances the actual like the cohesion of what you're trying to do with the brain and the outside factor and you collecting yourself into that world.
Yeah, I've read that they use a lot of laser guided or low level light therapy to direct the stem cells. Have you seen anything about that?
Yeah, big research. So the big thing about like low level or like laser, what it's trying to do is trying to excite the nitric oxide. So nitric oxide is that little gas that vasodilates our small vessels to increase circulation. So if you get increased circulation, well, the uptake is even faster for regen. So anything you can vasodilate the small vessels, it'll uptake the regen into the systemic and the target tissues.
Okay. So when you think about the future of regenerative medicine. Where do you think we're headed?
Oh,
Where
yeah.
we,
We're heading into the way I look at it is regenerative medicine is going to be in the patient's hands. It's going to be where we have control of this thing. No more pharmaceutical world, no more like that kind of world. It's more of a directive from you yourself that, all right, I know what I need done because I've been dealing with this thing. I can apply regen on myself, and it's a 30-day process. So I see it's back in the patient's hands.
yeah. So how can people find out more about RheeGen?
Okay,
Where would they go to learn more?
yeah, you can go to www.regen.com. There's probably some the phone number. I'm sorry, I don't know the phone number, but I think Regen's the fastest way. And also ask your local chiropractor, your provider about Regen, and then they can contact us because we are expanding out to that aspect of the practice.
That's great. Well, I appreciate you sharing this with us. I'm using it. I'm going to be reporting my findings to BrainTap Nation. We're using the NeuroCheck, for those that know our device, showing the upregulation of what's going on. And Cynthia, my wife, is using it on her neck. So we'll see if we can accelerate that healing. But I'm excited about it because I know it's like to do a real. There was a doctor in Arizona we went to. It was like $23,000 to have a stem cell process done. That's very expensive, and you're supposed to feel something afterwards, but it's unfortunate because it's inside your body. You don't really feel it, and then they say we need to do it like every 3 months or something, and that could be quite expensive, $100,000 a year or more. So with RheeGen, is there a protocol for lifetime use, or is it just a once and done, or how does that work?
So right now we're in again the musculoskeletal world. So we look at that, let's say just like a tendon or a muscle, something that has that chronic or that repetitive injury. So that takes, if it's grade one, it takes like maybe one kit, maybe two kits. But when you look for the lifelong process of how to like look at it systemically, there's a next step in this evolution that we're involved with, that we're going to get out of the actual musculoskeletal sports related injury and go into systemic and health and overall. So with that, that may be a possibility. So we're now advancing into that world. Anything you can think about, because in our body, it's difficult to get to every single cell in just a simple application. So it may take some time as far as the saturation, but once the signaling starts, it goes. It's very unique about that. It's just because of the amount that you need for the whole body to receive. That's a challenging question.
Okay, might need to have a bath that you go into with RheeGen and get the body all
Absolutely.
going there. So I appreciate you taking time out of your schedule to talk about it, because I think this is important, because a lot of people are hearing about stem cells. A lot of people think they have to go to Mexico to get stem cells, or some other country to get stem cells. But this is something that's available here in the United States, and they can order it from you. They can go to regen.com, like you said. We'll get the phone number and put it in the show notes. So if you're watching this on your computer, you can just scroll down to the show notes. You'll have the number to call RheeGen. Tell them you heard it on the Brain Fitness Podcast, and let them know that if there's any questions you have, obviously get them to us. We'll get them to Dr. Rheegen, and we'll work through all the questions you have. I think this is exciting because everyone's on the same path. Like you said, when we're born, we have all these stem cells, and as we age, it just diminishes until we can't make stem cells anymore, and then of course we're no longer. So
Yeah.
we need to, and that's part of the regeneration process. So I appreciate your time here, and I know BrainTap Nation will go and explore a little bit about stem cells. If you're aching in any part of your body, I would recommend you go check it out. It's a very affordable therapy that you can apply at home. Like you said, if you're going to a chiropractor or a physician and you tell them about RheeGen, you can share this video with them, share this with your family and friends, anyone who's having any discomfort in their body right now, because obviously pain is a signal in the body that comes from the brain, but that pain is telling you there's something wrong there. So the body is signaling you there's something going on there. It needs nutrients, needs blood flow and circulation, needs the stem cells to regenerate. So, let's get this out there. Let's get the word out there. I'm excited about this product because it's so easy to apply and it can be used anywhere at any time. I mean, now does the product, when it came, it was in a refrigerated case. We're keeping it in the refrigerator. Does it need to be kept in the refrigerator?
So we have 1 year's refrigeration lifespan, and then 6 months of room temperature.
Okay. So as long as you get it and you start using it, even if you're traveling, you can, I guess that's good for the sports people. If they're getting on and off airplanes and things, they don't have to worry about having a refrigerator there. So,
No. Yeah, you can be room temperature. Yeah.
Dr. Rheegen, thank you for your time. Appreciate it. And hopefully we get some people going over to RheeGen.com and activating their own body's healing system, the innate intelligence of the body. Once we activate this system, the body can heal itself, as you said. So thanks again for your time.
Dr. Porter, thank you very much. I appreciate it.
Okay. Thanks for listening. Remember, we're on a mission to better a billion brains. So if you're listening up to this point, you're one of those brains we're talking about. So please take advantage of what Dr. Rheegen has shared with you. If you're not using BrainTap right now, remember you can go to braintap.com. There's a 14-day free trial there. If you don't like it, it's no problem. You don't get charged until the 14th day. Just cancel before the 13th day, and you'll still get the 14th day, but you could try it. One thing is suspend your disbelief long enough to try these things out. There's new science out there, like the RheeGen product. We can heal ourselves. We can take over our health, because the best insurance policy is not the one you purchase. It's the one you do for yourself. Taking care of yourself on a daily basis is your best insurance, because the number one cause of death in the world is actually medical malfeasance, because the body reacts to, like you said, whether it's an injection or a cut or a surgery. The body has to heal from those things, and it takes stem cells to do that. So again, thank you, Dr. Rheegen, for being here. Thank you, BrainTap Nation, for listening. And please stay tuned to the next Brain Fitness podcast, where we're bringing you insightful information that will help your mind and body to heal, to grow, and to change the world one brain at a time. Thank you.
Thank you for joining us on our mission to better a billion brains. Follow at Dr. Patrick Porter on social media for updates, and remember to practice brain fitness every day.